everyone. Welcome to Tuesday night. It is the Dr. Boz Show, and we are talking about, is keto going to give you a heart attack? Let's start with the basics. What are the three major predictors of a heart attack? And you have control of all three. We're going to learn about that tonight, and it might have a little bit to do with the video that came out last Friday. But I think you're going to love it. We've worked on some pretty good slide content. Before we get started, we're going to do a tradition here on the show, which is to check my numbers. Yes, I am fasting, and Easter was pretty good. It wasn't perfect for me, but I did fast. But I had kids in town and teenagers and lots of fun activity, actually. So I was happy to fast by the time Sunday came around. But it was not surprising to me that when I woke up this morning, my numbers were not wonderful yet by any means. So glucose of 73 and ketones of 1.6, not too bad. I'm actually going to do, last week, for those of you that tuned in, which actually the number, 70,000 people tuned in the last week to watch a live show, which is an hour long. That's crazy. Anyway, so much for eating butter live. What I'm going to do tonight is eat a handful of MCT, and we are going to check my numbers at the end. Again, how many would I take? Well, I am very keto adapted, and if you want to spin butter through your body to get ketones, yes, it does a lot of things, and they taste lovely. But if you're really looking for high production of ketones, you should use medium chain triglycerides. All right, so how many am I taking? 1, 2, 3, 4, 5, 6, 7, 8. Well, I have 12 in my hand. We'll see what that does. Again, I don't know how much it's going to raise my ketones in an hour, but you'll be around to see because this is a live show. Let me just, while I'm doing that, double check to see that everybody can hear me. Oh, and I've got lots of people checking in. Hello, Sue Monroe. Thanks for the message you sent us this past week. All right, that was 4. Here's another 4. And the last 4. All right, well, let's see how that works out. So, as per usual, we are going to answer your questions again tonight. So my troops are watching for your questions, and we will repost them. We do try to stick to the ones that have to do with tonight. So if you've had a heart attack or you have specific questions about a heart attack, I would love to help you answer that. And I just need to change a couple of the things about how my setup is here, and then we'll get started. All right, here we go. Let's hop over and get right to the lesson because it really is good. There are several misconceptions about how people look into their risk factors, or when they get on a ketogenic diet, we hear them writing in saying, am I not going to have a heart attack? Am I not going to have a heart attack? And although we've done a ton of education about this, sometimes I think the basics are really important and people forget. They get all focused on, is this saturated fat? Is it a trans fat? And I'm like, wait. Let's back up. Let's talk about the 3 things that really do set people apart for whether or not they're going to have a heart attack. So the number 1 biggest risk factor that has been around for a long time and that is very well known is, smoking. If you want to prevent a heart attack, the number 1 most important thing for you to stop is smoking. And I don't mean just the nicotine, I mean the smoking. That when I look at the equation, when you look at the equation for people who say, yes, I use that, I smoke cigarettes, but as soon as I stop smoking, I gain weight. Well, in the chat, take a guess, and if you've heard this lecture before, don't give it away, but take a guess at how many pounds are allowed before you have the same risk in a 30 to 40-year-old patient who smokes cigarettes versus doesn't smoke cigarettes. Meaning, when you come into me and you're 35 years old and you've been smoking cigarettes for a half dozen years, and I'm saying, hey, you got to quit the smoking, you got to quit the tobacco, you got to quit the tobacco. And they say, but I'll gain weight, but I'll gain weight. How many pounds do you have to gain before you have the same risk factor for a heart attack that you would if you stopped smoking a pack a day? So I'm not going to give it away. I'll let you guys have a few minutes to answer it while I go back to the lecture, but it's a very surprising number. Okay, back to here. So I want you to notice that I did not say that it was nicotine. I said it's tobacco that predicts that heart attack. That nicotine is a chemical that is used and abused. It's loved by many in the world of addiction of chemicals, and just like all these other chemicals, like a neurotransmitter of anandamide, neurotransmitter of glutamate, neurotransmitter of serotonin or acetylcholine or GABA, we have mimickers that all work at making the dopamine fire downstream. Dopamine is that definite little neurochemical that, it gets all of our attention. Sex, drugs, rock and roll, any way to feel better. But it is like the three little bears, too much, and you have psychosis. You see and hear things you shouldn't see. But too little, and you have Parkinson's. So it is that sweet spot. But if you want to mimic anandamide, cannabis does that. If you want to mimic glutamate, hallucinogen, glutamate, PCP does that. If you want to mimic serotonin, hallucinogens do that. If you want to mimic GABA, alcohol does that. And all of them stimulate dopamine. But if you want to stimulate acetylcholine is a neurotransmitter that really does make us have energy. It increases our focus and memory. And nicotine is your lookalike for that neurotransmitter. And acetylcholine, yes, binds in that receptor just like all the other ones, but this is one we're talking about tonight. So, and it fires dopamine downstream. And you feel good and you get a little buzz and you feel energy. And then your body recycles both the acetylcholine and the dopamine. And then the next time your body wants that, it stimulates it. But if you want to mimic it, add nicotine. Not tobacco, nicotine. And boy, oh boy, it binds into that receptor and it fires the tar out of dopamine. And then if our acetylcholine comes along, it says, well, my parking spot is filled. I can't seem to fit where I'm supposed to. And the longer that happens, the less acetylcholine we make. And it's why quitting can be really difficult because they feel sluggish. They have an increased appetite. And as we continue to upregulate those receptors, we now have more parking spots where acetylcholine should park. But that just leads to another feel good every time they have a hit of nicotine. Downstream, it is causing the dopamine to still fire at first, but over time, our brain stops having enough time to rebuild the dopamine. So they have a hit of their cigarette and it really doesn't do as much as it used to. That's part of being addicted. Oopsie daisy. So this slide, yes, tobacco is what I'm talking about, not nicotine. When we look at the increased risk for a heart attack, it is the number of years spent smoking. And several of you have written in. I just want to say thank you to the first one who got it right is CD Bachelor at 100 pounds. So yes, 100-pound weight gain is what it takes if you're going to stop your cigarettes and say, but doc, I don't want to gain that much weight. Please, I don't want to gain that much weight. You have to gain 100 pounds if you're in your 30s and you're at a pack a day for you to have the same prevention so you get to carry 100 pounds for a pack of cigarettes that you're consuming at that age. So yeah, pretty significant risk in a heart attack. So let's move on to number 2. Number 1 is the tobacco. And today's world of people who do struggle with being addicted to nicotine, it is a very addictive chemical. It is much more addictive than caffeine. It is very difficult to come off of because those number of receptors that I showed that acetylcholine upregulates the number of parking spots. It's really a lot to come off of it. But nicotine gum. The nicotine is what you're craving. The nicotine is the chemical that you're after. And there are plenty of non-tobacco ways for you to add that to your system. All right. Risk factor number 2. Risk factor number 2 is high blood pressure. Yes, high blood pressure is a risk that over time, especially, causes your system to have an increased amount of pressure on it. And this is what causes one of the biggest risk factors for a heart attack is what is your blood pressure. So if we back things up, what is high blood pressure? High blood pressure, let's use this measurement because it does change with different risk factors. It does change with age, but let's just say anything over 130 or over 80 gets you a pretty good predictor of a heart attack, especially if it's happening over time. So I think it's really important also to point out that high blood pressure is talking about the pressure that's inside the arteries. Yes, the hoses that wind around your body. I want to know what is the pressure inside the arteries. And when you look at what this 130 is looking at, when this heart goes lub, it squeezes and pushes the blood forward. When that blood goes forward, it causes a pressure wave in your artery. When the heart relaxes, that's where it goes dub. Lub, dub, right? So when the heart squeezes, it has one high pressure. That's the top number of your blood pressure. When the heart is filling, the blood still moves forward in those arteries, and the amount of pressure that's still present when the heart is relaxing is this bottom number, your diastolic number. I actually want to take just a minute to point things out a little bit. When you look at the dissection of an artery, the arterial wall, which has a lot of places for pathology to show up, starts with this inner lining called the endothelium. So this is just two different cuts of your artery. That inner wall, that inner lining is where you keep a slime layer that really protects you against the pressure that's inside your arteries. And it's the tobacco that breaks down that slime layer on the inside of the skin lining of your artery. There's two other really important parts to this. One of them is this little elastic membrane that's part of your arteries. It's what gives it such resilience over the years of being under pressure. And then a striking difference between the veins versus the arteries is there's a muscle layer around each of the hoses called arteries. Now, those are several layers deep within the system of our bodies that protects us and allows us to be able to endure years and years of pressurized flow of blood. But there is a tipping point. There's a tipping point where too much pressure changes how some of the organs age, and this is where a heart attack comes in. So I just want to show you another little way. When you're looking at let's just take what smoking and nicotine both do, is they do raise your blood pressure a little bit. So if you look at a vasoconstricted, where a muscle is very thickened or it's contracted, that arterial hose, the part in the center, this part right there, is smaller. It contracted. Now, the artery can then have a time where it vasodilates, and now that arterial surface is much, the lumen or the central canal where the blood flows is now much greater volume. And for any of you physics geeks out there, the diameter of that equation is really, or in math it's actually the radius, but the diameter of that tunnel is really the most important part of the pressure. So when we look at blood pressure medicines, most of them are focused on manipulating how well this muscle relaxes and whether or not it can contract, as well as how fast your heart can beat. All of them, when we can lower the tension in that muscle and keep the pressure inside your arteries a little less, very important for the longevity of the end organs inside your body. Okay, let's keep going here. So when I say end organs, I do mean that there are, as the pressure throughout your body, throughout the arteries, pushes all the way through the system, delivering that freshly oxygenated blood, what happens at a very integral part of our system at the capillary bed is it goes from an arterial system to a venous system. And so this side has pressure on it. This has no pressure on it. So arteries versus veins. And where those arteries turn into veins, well, that's a key component for where our systems see the first signs of damage that do predict a heart attack. They do predict whether or not your system is feeling that sensation that, people go on a ketogenic diet. Doc, I'm afraid I'm going to have a heart attack. Well, tell me, what has your blood pressure been for the last 30 years? Here's another, just look, in this artery, you can see all those layers to this. This vein has a very thin layer right here. Oh, maybe I should put that in green. A little thin layer right here. And it's so likely that it's so likely for the blood to backflow that our veins are built with a valve to stop the flow from going backwards. So the flow will go forward, it'll go up through this valve, and then when the flow isn't being pushed forward anymore, these little valves will close because there is no pressure. There's no blood pressure in the venous side of that hose system. So let's talk about this a little bit further. So we've got a venous side, we've got so here's your veins. I'll make it white. Here's your veins, and this is your arteries. And in the middle, we've got the capillaries where it changes from one to the other. But the tissues where you transition from arteries to veins are where we see the hint that you might be getting closer to that heart attack than you should. All right, so here's your next question. If I was going to check to see which part of your body is the canary in the cave predicting your heart attack, what is the easiest and the most economical, as well as the earliest detection signs that there might be a problem with too much pressure? So take a look at this. When the pressure is high, that arterial wall, this one looks beautiful, lovely. You can see all these skin cells are tightly closed, right? But under pressure, we can see that those skin cells don't connect together anymore. There's spaces in between them. So that skin lining on the inside of those arteries now allows fluid to escape. As the fluid escapes, well, this is what happens. You start to see edema or swelling inside the tissues. And one of the places that I have patients check is they learn how to do a shin thumbprint to see if there's any of this water, this fluid that you can see here, right in here, any of that fluid to get into their tissue. But I want to know, and I'm still waiting for folks to type this in, which organ and what blood or what lab test would teach me, I see danger. And you can see it up to 20 years before the heart attack. So we do have the 4 most likely organs that that affect the pressure in your body. They're very vital organs: eyes, heart, brain, and kidneys. One of these is where this really important test comes from that shows me how likely is it for me to be able to see in a patient who's 20, maybe even 15 years away from having their heart attack. And we can warn them. Say, hey, guess what? I see the heart attack coming. It's in your labs. I'll give you a hint that the lab test is cheap. The lab test is something I do on every patient from the age of 30 on. Okay, so a couple of you have guessed it. Oh, I'm so excited. So let's look at the things this is just another example. If this is the tissue in your body, and we look at right here is where the blood is flowing, right? So you can see those red blood cells flowing through along here. And now, as you see, this is a fat layer. This is the fat layer. Here's the skin layer. This is skin. But when the pressure and the leaking gets high, we see the the edema or the swelling go out into a tissue layer, and then your immune system tries to fix it. But when that's happening in areas of your eyes, heart, kidneys, and brain, there's lots of problems that go wrong there. So let's look at this. We have the brain, again, very vital organ, really important to see. Would this be the one telling us that there's a problem? There's a big red X there because the answer is no. The brain does not tell us very easily. If I want to test something in your brain, I probably have to do a spinal tap. I have to look into that cerebral spinal fluid. And as soon as you talk about needles going into tissues, well, it's a lot harder to talk the patient into that. For sure, your insurance company isn't going to like me to do that. But again, the brain's not great at warning me that there's a problem. So the second thing that's usually guessed is the heart. It also has an X next to it because, the heart will warn me when there's a really big danger sign going on. Sometimes when I'm looking to see if that slime layer on the central part of a blood vessel where we look down that blood vessel, if I want to look to see, does that inner skin lining still have its slime layer? There is a lab test called the highly sensitive C-reactive protein. And that test I do check on patients, but not nearly as often as I check this other one, trying to predict their heart attack. So if you guessed eyes, you are pretty close. I can see into the back of the eyes, and when there is that network of arteries becoming veins or a beautiful lattice work of vessels, when there's disease present, you can often see it in the eyes. But I have to see the disease really advanced before my eyes can see it in your eyes. So if you guessed kidney, you were right. That is the canary in the coal mine to tell me, is there a problem? So let's talk about that. So here's a couple of kidneys. Again, here is our arterial system. Here's our venous system. So here's the pressure that's high inside that artery. And then that blood is going into the kidney. And this venous system where the pressure is a low pressure system. So this is a high pressure system, low pressure system. And, I probably shouldn't do it that way. This is where the blood is flowing back out. This is where the blood is flowing in. My arrows didn't make much sense there at first. All right, so let's look deep inside the kidneys. And honestly, we spend a lot of time looking at kidney tissue when your disease is advanced. But the kidneys do a great job of telling me when there's a problem. So they do this very special filtering system where they take your blood and they look for all the stuff that doesn't belong there, and they take the trash, they put it into the urine, and then you pee it out. So the blood coming in has the trash in it. The venous system going out has the trash removed, and you should be able to find the waste in the urine. And if everything's going right, that's what happens. Here's just another picture of that. Inside the kidney, think of this section right, we'll use purple. This section right here is where you're kind of making, you're doing all that filtering stuff. You have high pressure inside those arteries, and it flows all the way down to that lattice work where it becomes an artery turning into a vein. These little capillary beds affect the end organs. The 4 top end organs are your brain, your heart, which is how it predicts a heart attack, your eyes, and your kidneys. Although I can look into your eyes, your kidney gives me the best canary in the cave that allows me to see 30 years in the running. You've got too high a pressure. You're leaking out the things that shouldn't leak out, and you're not keeping the albumin where it belongs. And this albumin to creatinine ratio is one of the best, and it is cheap. I do it in every patient that comes to see me from 30 years on. Because when it's normal, no big deal, and it's only a couple of dollars. When it's not normal, we have years to reverse this because it is so early in the pathology of what blood pressure does, that if we keep that blood pressure low enough, your albumin to creatinine ratio will not be above 30. I've seen it go from over 1,000, where we had a major problem. We took care of their blood sugars, we took care of their blood pressure, they stopped tobacco, and their albumin to creatinine ratio, it got back to 40. So it wasn't perfect, but way better than it used to be. And that is that process of saying, how terrible is it that blood pressure, when it's too high, how much does it affect what the kidneys are doing? And when people say, well, is my blood pressure okay? And they come into my office and we check their blood pressure and they say, oh, it's white coat hypertension. Oh, it's because I'm in front of you. You're like, okay, then check it at your house, because I don't care what it is in my office. I care what my blood pressure is in my office. I'm here all the time. But I do not want what their high blood pressure is doing in a 24/7 cycle of destroying their kidney tissues. Because if it's destroying the kidney tissues, it's destroying the brain and the heart and the eyes at the same time. So when people say, is my blood pressure controlled? Is my blood pressure controlled? I can look at your numbers, and that is a great way. So you tested it at home. You should know what your blood pressure is. And if they say, I just run high, you know what doesn't care if it just runs high? Your kidneys. Neither does your heart. That when we say, what are the biggest predictors of a heart attack? Number one is tobacco. Number two is high blood pressure. And it is not high blood pressure for a day. It's high blood pressure for months and years on end. And you can foreshadow if it's affecting you by checking your microalbumin to creatinine ratio. It should always, and I mean always, be less than 30. And most doctors check it. Okay, so there's one final thing that predicts a heart attack. But before I tell you that, I'm going to do a couple of things that are housekeeping that I promised my team I would not forget to do. So stick tight, because the final predictor might be a little surprising. Okay, let's start by looking at our website here. I do want to tell you that we get a new website in hopefully the next week. If everything goes right, you won't notice much, but we had quite the struggle with volume and really getting it to be as fast as we need it to be. So for about a year, we've been trying to play cleanup to make our website go a little faster. So pray that everything goes like it should, at which point your questions should be answered a lot faster with a couple of the processes that we will implement. So don't give up on me there. I do answer them here on this show, but I know lots of you have tried to get a hold of me in other ways. And Pin Chasers Tuesday morning is definitely where I am every Tuesday morning from 8 o'clock to 9:15. And I do that to make sure that my community gets to hear from me. But I have an important announcement of a setback, which I seem to share all of my setbacks with you guys. And that is that I upgraded my MCT to a beautiful clear bottle. It was a year ago this month, and the manufacturing on that is supposed to be good for 3 years. And if you go back to the analysis, the third-party analysis, the reports are beautiful and they're clean and they're lovely. But when we went to mark the bottles, I missed that they accidentally put the expiration date for a 2-year marker instead of a 3-year marker. So I have MCT to get rid of before the end of July. And if I don't get rid of it, I can't sell it. Even though my family and I will be consuming it for years to come, because the best part about an MCT of it being inside a capsule is that it goes bad when it's exposed to air, which is why I chose to put them in the soft gel capsules. But there's no way I can fix this problem except to sell what I have and start over. And it totally bothers me. But if you put 4 of these in your cart, you will pay the price of 3. And again, I can't advertise in any other way except to tell you what I would do. And that is that I'm not afraid of that expiration date. I know exactly how long these are good for. They're good for up to 5 years. So I set it for 3 years as a safety way for me to never get anywhere close to that expiration date. But when it's accidentally typed in as a year too early, and I missed it, you'll never find MCT any cheaper than this. So if you are, again, we love all the ways you help us keep this channel going. A mistake like that is really costly, and I just hope I can get rid of it before I run out of time, which is at the end of July. All right, so I am going to also say, for those of you that don't know anybody in Louisville, my friend Autumn lives in Louisville, and you may have heard that the bank shooting was yesterday in their community. So not only would I like to ask you to pray for Autumn and her Keto Palooza, but if you're looking to come hang out with me, I am going to visit and speak for her this year in October. So put that on your calendar. For those of you that are going on the Keto Cruise, which is the first week of June, I do think that's sold out, but I'll be one of the speakers there. If you are signed up for Keto Camp and you watch Mr. Ben Azadi, I'm one of his key speakers this week, so you can find that on Facebook over the next couple of days. It's a really good lecture. But if you're looking for the newest content, and you're about to see why you might want to see the newest content, KetoCon is in like a week and a half. And I would love, love, love to see you there to answer your questions. I don't have a booth, but I will tell you that Keto Mojo has allowed me to do office hours at their booth to just be able to answer questions. And I really do worry that I not having a booth was going to be a tough way for folks to come ask me the questions, which I think is the most important part of a conference, is that you get to meet the speakers and ask your questions and hopefully get to know us. I'll be going to the VIP dinner, so sign up for that and come hang out with us, have a little food. Maybe we'll get to sit at your table. I do see a couple of good questions here. What is the labeled expiration date? Yeah, the labeled expiration date is July 2023. I don't know if you can see that on there. And as much as that, even though it's not correct, that's what's on the label, that's what's stamped, and there's nothing I can do about it but sell it. Bugger. So thanks for asking that. All right, so let's get back to our final, what is the third thing? So the first thing that predicts a heart attack was smoking, because it does several things, but mainly it erases that slime layer on the inside of your blood vessels. Number 2 is high pressure, because of what arteries do versus veins. And number 3 is a very important lab test I thought that was going to be animated. Hold on, let's go back here. A very important lab test that is found in this slide. And I will be talking about this slide. This is actually building up. I think this is slide number 45 on my slide deck for KetoCon, where I build up to this point and I deliver what is ApoB. And ApoB is the third biggest predictor of a heart attack for people who are worried about having a heart attack. Control the smoking, control the blood pressure, or stop the smoking, control the blood pressure, and control the ApoB. I hope that you will join me for KetoCon and you'll hear exactly what I mean. Hold on here. Exactly what I mean by having a great lecture prepared. I got to test out a little bit of that on my my folks that show up at the support group at the Pin Chasers, which is the bowling alley every Tuesday. And I'm really thankful for them to be a part of my life, that they show up and ask me questions each week, and that I get to answer some of their questions while I continue to transition back to my normal life before I moved from South Dakota to Tampa, which I'm still not there yet, but I'm working on it. You guys might not have noticed much, but so lots of comments here off to the side. I do have several of your questions that have come up. I do want to just hop over to Spiro and say, not CAC or a calcium score. I'll tell you, we talked about that this morning in our support group, that the calcium score, although it gives me a sense of how much disease is actually in the coronary arteries, it does not tell me what's happening now. It tells me what's happened in the past, but it doesn't tell me what's happening now. And to predict a heart attack, you need to see what's happening now. coronary artery calcium score, I do think that's a cheap, easy way to look inside. There are some false negatives, meaning people that show up with zeros. About 15% of the people whose report says 0 is not actually 0, so it's not perfect. There are some limitations. And then once it's present, once the calcium is present, following it can be difficult to know, do we make a difference? Are we stabilizing those coronary arteries? Are we making it worse? So let's get over to your questions here. And oh, good. Sue Monroe is actually the first question on there. So let me get over there and see if there we go. Sue says, Dr. Boz, I did a coronary artery calcium. Thanks for suggesting it. Unfortunately, they found a dilated ascending aorta of 4.3, being sent to a cardiologist. Suggest just for arguing that keto is great for me with this. Well, Sue, thank you. Hello from Iowa, one of my Midwest folks. Nice to see you. I do, an ascending aortic. An ascending aorta is an artery, the biggest artery, that is dilated a little too much. It doesn't mean that you're going to die. It does say that there are risks. So when I want to say, I'd have to look up to see what the cutoff is. I thought it might be slightly different for men and women. So I'm going to have to not trust my brain. I'd have to look that up to see if 4.3 is dangerous or if it's kind of on the edge. But so here's the things that you should be looking at is predict your heart disease. Because the one thing I didn't go through in that slide deck that yes, you can control the blood pressure. Why was it 30 years old that I kept saying a 35-year-old who's smoking cigarettes, a 35-year-old who's smoking cigarettes? Because they have time on their side. When you drop, when you can add 100 pounds to that 35-year-old compared to what that tobacco did, because he's 35 years old. What you're going to spend over the next 20 years is how much time is going to be under the curve affecting that heart with the impact of tobacco, and secondly, the impact of what high blood pressure does. So, Sue, I do know that you've been around the sun a few more times than 35. So I would love to know the history, and your doctor should be careful that, I'm sure they will ask you the history of what has been her smoking history, what has been her high blood pressure history. Looking at your ApoB is another predictor of how much tax, how much problem, and the way to fix that ApoB is what we're going to cover at KetoCon. But the other predictors that your cardiologist should care about is that homocysteine level should be kept very low. That should not be skyrocketed. Your uric acid should be in the 4s. God bless you if your uric acid and your hemoglobin A1C are both in the 4s. Those are other things that that you can dramatically improve with a ketogenic diet. When I look at how to reverse the impact of what smoking does to the insides of those arteries and how to reverse blood pressure, the first thing I do is clean up the average blood sugar. I want to lower that A1C. The impact on the excessive fluid, not the fluid that was leaking out at the end of the tissue, but the fluid that is in those hoses, is a dramatic shift of improvement in the first 2 weeks of a ketogenic diet. We can lower that blood pressure. Now, it's the staying consistent that really give you the benefit over time, that how well did that blood pressure get controlled, and is it a risk that's going to worsen that ascending aorta and dilate it further? Keeping the blood pressure controlled is really important. So, good question. Thank you for asking it, Sue. All right, let's go to the next question. All right, next one is from Susanna. Hello, Dr. Boz. What are your thoughts on... Okay, it's a live show. You gotta put the words in there, guys. I can't remember what LMHR is. Low molecular, don't know. You gotta give me this stuff. Let's go to Tony. Since I have peripheral vascular disease, am I more prone to having a heart attack and need statins? Well, peripheral vascular disease, it actually plays right into those pictures that I showed earlier, where the tissue is leaking out the fluid. That fluid gets in the tissue. And, one of the predictors that we were talking about this when I was explaining which slides I should use with my team, there's a really good image I have of as the blood vessels leak. I wonder if it's still in my slide deck. It might still be there. Oh, if it is, I'm going to use it. Oh boy, he took it out. Dang it. Anyway, it shows this picture of a blood vessel where, you know how that blood vessel cracked open and then it wasn't sealed as tight? Your immune system can get outside that that vessel at the same time. And along with it comes hemosiderin, which is kind of a dusty gray look to the legs after hemosiderin has been deposited in the tissue time and time and time again. With that, so think of it as the iron that should be circulating around your bloods on the hemoglobin gets deposited into the tissues which is highly associated with advanced peripheral vascular disease. So when I hear people have a severe peripheral vascular disease, it is another end organ where the artery becomes a vein, and then that capillary bed is, the link between these two areas. That pressure gets all the way to the end of that hose, and it impacts the tissue. One of the ways to see that disease is the grayness found in peripheral vascular disease. It has a high hemosiderin deposit. It has a high link to life expectancy. So when I hear somebody who has a peripheral vascular disease, the first test I would be looking at is, what's your albumin to creatinine ratio? Because the kidneys and their vascular bed have been affected long before the peripheral vascular disease. So how well have your kidneys been able to repair and keep the albumin in the blood, not in the urine, no microalbumin in the urine, and how well has it been able to keep the creatinine in the filtered and in the waste side and the blood nice and clean? So that's a great way to look at your whole body's impact from what the blood pressure might have done. So having peripheral vascular disease, if your blood pressure is still high, increases your risk of a heart attack. If I pray to God you don't smoke tobacco. Having nicotine is something that can be really difficult to give up, but having a disconnect between the diagnosis of peripheral vascular disease and not knowing your kidney function, that's a party foul. I would definitely want you to do that. Okay, so now everybody reminds me, which seems obvious when I'm looking at it now, that lean mass hyperresponders, that is a very advanced question for that would take me some slides to answer. Let's go back to the question so you know what I'm talking about. So the team writes in and says, yeah, LMHRs are, Dave Feldman would totally kill me that I didn't remember that. So they are lean mass hyperresponders. So you should ask me that at KetoCon after I explain those slides, because you're going to have a subset of people that says, I still want to know what's your ApoB. ApoB. And I would bet that Dave Feldman might not agree with my answer. I don't know. We could talk about it. Okay, so what are you taking? I'm not familiar with MCT. Oh, well, first of all, will MCT raise your triglycerides? No, it will not raise your triglycerides. Yay, Beth, that is the best question. And the video that we are going to link at the end of the show is totally going to be explaining MCT and why they're so important. So when I talk about MCT, I get really excited because I'm like, it's such a super hack. Everybody should use this on the ketogenic diet. And when I'm taking care of my cancer patients, when they're in a phase where they can't hardly tolerate anything, I have them drink Pucker Up and swallow at least 12 to 18 of those capsules for MCT twice a day. And you say, why do you do that? Why do you do that? Like, because first of all, they're hurting. They need the fuel, and they need the fuel without inflammation. So medium chain triglycerides, you're going to see in the video. They're not it's like mama bear, papa bear, and baby bear. They're not too long. They're not too short. They're medium. And they are still the longer lengths of chain that your body doesn't have to digest it like it does butter. Butter you have to digest. I mean, there is a little bit of ghee in butter, or ghee, which are short chains. But the problem with a short chain is you only get a few ketones out of every fat string. In a medium chain, they are still able to be absorbed, not digested. So they're quickly put into the circulation. And once in the circulation, the liver will spin those out and turn them into ketones. Now, the danger of me checking them on a live show is, I'm fasting, so it should absorb. But I'm saying all this before I check my numbers, I might notice. And it is a great, it just delivers the fats to the mitochondria in my liver that will turn them into ketones. Again, once you make a ketone, you can't store that ketone. You either burn it or you pee it out. So when people swallow that ketogenic, they swallow ketones like in Pucker Up, it will only raise their ketones for a short while. It's why I can swallow it on the show and have it affect my numbers by the end of the show. I do that just so you see this is real. This is really live. Microphones do crash on shows for no apparent reason, but they did. So as I prepare to check my glucose and ketones, the best bet would be to check it at 10 o'clock tonight after I've had a good chance to absorb all that fat, because I'll be making ketones like you can't believe in about 3 hours. And I know that from past experience, but I still, especially in light of what my our team at Dr. Boz has run into, if you are looking to store this, it'll be on my shelf for years if we don't get through it all. And I won't be afraid to take it, but I can't sell it when the stamp on the bottle says that. So thank you for those of you that have already gone in and purchased it. So definitely taking that MCT it's another way to raise ketones. And again, I'm not just about chasing ketones. I mean, how do you make ketones rise, especially to fit the pathology that you're trying to defend? In losing weight, in fighting insulin resistance, ketones in circulation shift the metabolism. And we are trying to get your mitochondria in better shape for that. So as we do that, the swallowed ketones and Pucker Up last a short time. When you swallow the fat, it can turn it into ketones for 6 to 8 hours. Way better. I would never keep up with swallowing the other ones. Let's do one more question while I check my numbers. Thanks for asking that. Okay, so Carita in Alaska. Can I take MCT capsules while doing the 21-day sardine fast? You could. The types of fat that are in a sardine are there's lots of medium chain triglycerides in a sardine. So I would say, if I were you, I'd take the MCT when you're not doing the sardines as a way to say, keep the strings of fat going into those mitochondria. Keep those mitochondria in shape for twisting that fat into ketones. I mean, I think the beautiful part about people that are fat adapted when they swallow MCT is how much they burst their ketones. You gotta swallow a lot of them. So many good questions. I'm interested in knowing how many to take at a time and how often throughout the day for Parkinson's or Alzheimer's. Okay, so that's a really good question too. Well, we should be answering all these. Let me check my numbers while I answer that one. So this is exactly where MCT is the most important. When they have chronic brain disorders, again, we're not going to fix that in a few weeks of being ketogenic. I need you to be ketogenic for 3 to 5 years. It doesn't take that long to see the results, but to reverse some of the processes that have happened already inside the body, time on our side is what we need. So keeping people ketogenic, once they're fat adapted, once their mitochondria are already doing what they're supposed to, adding those MCT, I mean, if it was my parent that had Parkinson's, I'd be doing 12 to 18 capsules at least twice a day. So I'd put them in the morning and I'd put them in at like 2 o'clock. Again, getting 2 bursts of really good ketones because of, the other part about C8, C10 is they cross the blood-brain barrier without being broken down. So it's the longest fat that can cross the blood-brain barrier. And again, that fat can then be used for fuel. C8 and C10 can be a fat used for fuel. You don't turn them into ketones, you use it as fat, and the fat feeds the Krebs cycle inside the brain's mitochondria there. But you have to have them in circulation. So you'll get the first wave of those MCT that cross the blood-brain, or that turn into ketones. But whatever doesn't get spun into ketones now circulates in the body as as part of the fat, but the length of the fat of C8 and C10 can cross the blood-brain barrier, which is where it's really helpful for those chronic diseases of aging. And again, it's a lot. I mean, I put 300 and some capsules in here, but that's a month's supply when you're doing brain treatment. You can't start there. If you're not fat adapted, you can have one capsule that some people get diarrhea because their body's not ready for it. So it's really meant for those people who are trying to churn steady ketones for brain health, for autoimmune health, for mitochondrial strengthening, all of those, very helpful. Okay, so now my timer went out, so let me try that again. Okay, I didn't prick my finger though. So remember that I am super excited to see any of you that do go to KetoCon. I will be on site. I think I'll be in Texas, but I'm going to land in Dallas. And then I have some work to do in Dallas and then to travel down to Austin. So 79 and my ketones, drum roll, 1.5. So yeah, I bet if I check that in another hour or so, you're going to see this up into the higher 2s or at least 2.5. That's from personal experience, but I haven't absorbed enough in an hour to get it to spike. So, well, that's what you get on a live show. I continue to answer your questions on this show, and I look forward to seeing all of you at those events that I'm going to be at. Thanks for helping out our business by stocking up on your MCT, getting 4 bottles for the price of 3 on our website, and look for those discounts throughout some of our social media as well. I will see you in Austin.